thank you all for being here for our advocacy. We call this quarter, we're almost into quarter 3. This is our quarter 2 training. We're part of NHF's state-based advocacy coalition. So we have a partnership with them, and we provide these 4 quarterly meetings to make sure that we keep all of our ambassadors and everybody up to date, and everybody knows what's happening, and you are, super in charge and motivated and everything else to be with us. So again, thanks so much for being here. I do want to, this is also our 3rd day of our conference, our HELLO conference. I do want to say thank you again to all of our sponsors who have sponsored this event. These things wouldn't be made possible without them, and all the boxes and everything that you got with everything. So again, thank you so much to all of our sponsors for being here with us today. So we're just going to go through really fast a couple of, and this is our advocacy coalition. Now, I have to say something about this, guys. So we are rolling out, and as Nathan was talking a few minutes ago, after tonight, we have a new logo. And I'm looking at this going, oh man, I don't know. This is a different coalition. Maybe we'll keep this logo for a little while, but this has been on our state-based South Carolina Hemophilia and Bleeding Disorder Advocacy Coalition. That name is not changing. So we may have to update the little blood drop, which we do have a new blood drop, and you guys will reveal that tonight after our painting event. But anyway, so again, thank you for being here for this journey that we've been on. We're going to go over just a couple of really quick objectives. So the main part is I want to make sure that people know what our advocacy coalition does, our ambassador program. I'm just going to give some quick highlights on that. We are going to recap our quarter 1 and quarter 2. Like I said, we divide our year-round program into quarters. So we have quarter 1, quarter 2. We're going to be going into quarter 3, which we'll be doing at the beach in September. So obviously, we hope everybody joins us at that time. We are always looking for additional additional ambassadors all the time. So I'm always hoping that we can educate and bring in more people, and they join everything that we do. We are going to hear from Nathan from NHF. He's our state policy vice president, and he's part of our team, works with us religiously. So we're thankful that he's taken the time to come and give us our national policy update. We're honored to have today with us our national organizations for rare diseases, ANISIA. ANISIA is with the South Carolina region. And so we're going to talk about our RDAC. And then we're also going to recognize Juneteenth with some understanding, the deep understanding in our community for our African-American population and our individuals. So we're going to recognize that with a quick video and share our support to our African-American community for this great recognition of Juneteenth. So here's a little picture. I just want to share a little bit of something. So if you if you weren't on our opening remarks for our annual meeting, we gave a Advocacy of the Year award to our state legislator, Adam Morgan. He had worked with us twice, well, actually 3 times on some training, and then in our advocacy programs, and then also in person. So it was fitting that we gave him the award. He was really honored for that. But one of the things I really loved that he had said was, we need you, the people that we serve in South Carolina. I kind of have summarized what he said. We need you to tell us what we need to know. We don't know what we don't know, and we need you. And I thought that was a really special remark that he said. And that's what this whole program is about. I can sit in my office in Greenville, and Nathan can be up in New York and everywhere else. We don't know what we don't know if you don't tell us. So as a total group, we are constantly educating ourselves and making sure that we need you as our ambassadors and our coalition members to tell us up here what is happening in the state, that we can go and help be a part of that. So right now we have 19 counties that are represented to date. My goal before I retire would be to have one representative in every county of the state. So if you're on today and you see that you live in Aiken, and I don't have you as written down as you are one of our ambassadors that I can call upon, and we can help bring you together and educate, then we need to hear from you if you are interested in doing that. And I just, that you can read this a little bit, if you get this policy, or not a policy, but you get a packet that has all this information, but you drive the efforts of what we do in South Carolina. You are volunteers, you are leadership positions, You build strong grassroots, you help us build a strong grassroots network of bleeding disorder advocates that can cover all bleeding disorders, von Willebrand's, our rare diseases, and help us understand the challenges that face our community. You help us with our mission, and our mission at the Advocacy Coalition for South Carolina is to help bring you a voice, to help you build your voice. So taking our training and being part of this program, you become great advocates, and you've shown that over and over again. You are the liaison between the public, our state agencies, and our elected officials. And so we're very proud of you and honored that you choose to continue to be here with us. And, you know, on that note, I'm going to tell you why you should be here. Greg, go ahead. So why should you join? Well, because something that people say is because Sue told me I had to. And I laugh at that. But to be honest with you, I do tell you, you have to, because I need you. We need you. South Carolina needs you. But really, realistically, one of the great things is you are amongst hundreds of people in our community throughout the nation that work to help improve the lives of those that are affected by bleeding disorders and to help us access affordable care and treatment for all. So you get the opportunity to meet with connect with members. As of today, we don't have closed meetings as ambassadors, but we do meet. We meet monthly as a coalition member. If you want to raise your level of understanding and be part of the coalition, we meet monthly. We discuss things. You are also, because you're part of this whole program, you are in the know. So if you realize the other day, I sent out an email with information that's exciting that you will get before anybody else in the chapter gets. So you are always constantly in the know. You're getting the information. You get to develop great relationships with our key decision makers and people that have opinions. It's your work that provides us the ability to get to where we need to be. You receive the information, like I said, on a quick notice. You're part of our team, and then you get to address all the issues that we have in our state and making sure that we have treatment care. Greg? So I'm excited about this. As I talked about stories, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I truly, truly believe that. Margaret Mead had quoted that. Because your stories, and when we talk about stories, it's not just kind of a story, but it's things that really, really impact you. How do these things that we do impact you? And how would your story of how it impacts you help policymakers to understand what they need to know, as Adam Morgan has said? So I'm excited to say that we are going to be doing an op-ed with the new running Senator Mia McLeod, in support of our Rare Disease Advisory Council bill. That's going to be worked on throughout the summer, I think released right before September, before the session's starting to get back up. So we are going to take your stories and make sure that we're going to make sure that the story that we're sharing in the op-ed is about all of us collectively and why we would need a Rare Disease Advisory Council in the state of South Carolina. What will that do for hemophilia? But more importantly, what would that do for all rare disorders, which we are just one of 7,000? So on that note, I'm going to be quiet for a minute, and I'm just going to ask, does anybody want to share what you have done or what this program has been for you? I always love to hear your voice of what you've thought about being a part of it and anything that has helped you in your own personal lives, or being part of the team. And if somebody doesn't, I'm going to call upon you. So you have to just unmute. All right, I'm waiting.
Yeah. Okay, I'll speak.
Hi.
Yeah, I've been going to many meetings and get-togethers, and every time I go, I've learned so much more. Like family, that we share our stories, and it's just been so invaluable. And that's how I take home, because I feel like I have support if I need to reach out and ask, because I'll always get an answer, especially from you, Sue.
Hey, it's all teamwork. Thanks, Susie. Appreciate that. I saw Shelly, you had yours undone. You want to say something, sweetie?
Well, I was going to say, actually, now that I've been meeting with the representatives for a couple of years now, I see them out in town now, because I live in a little community and we talk, we know. So I'm able to say, hey, so this is what's coming up, just a heads up. And so he's aware of it. So it's been pretty cool just to be able to say, hey, this is what's happening. They recognize Lucas and they know, they're like, hey, I don't want to say we're friends because we're not friends, but like we are able to actually have a conversation outside of the bleeding disorders, but be able to be comfortable enough to say, hey, just a heads up, this is happening. So it's pretty cool.
Good for you.
Thank you. Holly, did you want to say something?
Yes, I did. The comment you made a couple slides back was that you made some of us do this. I actually have to say you've encouraged me because I have wanted to advocate, being as I consider myself, since I was found unfit medically by a state. I wanted my voice as well as my son's voice to be heard, and I just never had the support or anything to do it. And since moving down here about 10 years ago, and meeting with some of the dinners and stuff, you encouraged me to have a voice. And now with some of my other extensive family court issues, I'm separated from my son. So he needs a bigger voice in the community, because his dad just, in their words, don't have the time because they have 5 boys in the household. By the way, this is the little guy. I've taken the opportunity to speak to the senator or the House representative here in Lancaster this past March, thanks to the support of you and the encouragement, just to try to get my voice heard in some of the family court issues I've had. So it has been nice. Robert my husband was going over some other things, and I'm like, one step at a time, let me get comfortable in this setting, and then we'll move up.
Wonderful.
But just one step at a time. So
One-
I'm hopeful.
One step and one voice. Appreciate that. We were happy that we were able to help you find your voice, which is part of the mission.
Oh,
So on that note, I'm going to go ahead and we're going to go back and let Crystal is on, and she is our advocate. Where'd she go? There she is. Crystal, do you want to say a few words? Welcome everybody as our Advocacy Coalition chairwoman.
Yes. I just want to say thank you all for everything that you're doing, and just for being willing to step out maybe of your comfort zone to talk to and make aware of things that are going on. I love to see how, as long as I've been doing this now, to see how people first were so cautious and so scared, and then once
Did we lose her?
Oh, are you losing me?
Yeah, we lost you. Sorry. Go ahead.
Sorry. Okay, I'm back.
There you go.
Okay, good. I just, saying thank you and just learning how to use your voice. I've always been an advocate for my son and trying to make sure that, his needs are met. But I love how we're all stepping out of the comfort zone and learning how to use our voice for the future, for our families, our kids. As Shelley was talking about her son getting out his port. We have hunters. We kept his because that's a part of him. But we have these stories to share, and they mean so much to us. And by sharing these stories, we're making connections with our legislators, and we're making changes for the future that now is different than when Hunter was born. When Hunter was 20, when he's 20, getting ready to be 24, when he was born, it's changed so much in those 24 years. And now we're talking about Medicare and nursing homes for our ailing, hemophiliacs and bleeding disorders people. And that to me is, I know it sounds weird, but it's a blessing, because I only want my son to, and my family to have a great life or whatever, and have the opportunities. And I love that we're thinking past just getting them through the crazy child years, college years or whatever, that there is life past that. And Hunter is doing fabulous. We've made a lot of changes, and we've got to keep going forward. We've got to keep raising our voices, keep getting knowledge, keep getting being driven, because this is a passion of mine. And the more that I do, the more passionate I get, because I see results and our voices are being heard, and we got to keep it up.
Absolutely, Crystal. Thank you so much. Very nicely said.
Mhm.
So on that, we're going to just change over and we're going to go to Jeremy. Jeremy Williams is our advocacy consultant that works for us. And he's going to do a recap of what we've accomplished in our Q1, Q2. So you hear me say that all the time. Quarter one and quarter two, it's just a lot easier to say Q1 and Q2. So Jeremy, give us an update what we accomplished as a community. Many of you are part of this. If you're not part of it and you want to be part of it, we want you to be part of it. So go ahead, Jeremy.
Yeah, great. Thanks. Yeah, so this year, just like every other year, we started in January making phone calls, getting ready for advocacy days. And obviously everything was virtual this year, so that presented new challenges. I think my final tally, we had 25 Zoom calls or conference calls, not just a phone call with, it was staff and members and the actual legislator. So that put us at 25. And then if you count, things fell through. We had legislators that, things pop up. If you add in all the actual legislators who said, hey, I can't be on this call, but please send me information or please get the member in touch with me, then we had over 30 contacts with legislators regarding our legislative agenda this year. And we had 42 members. I'd be remiss if I didn't, say that, and I know several of you are on here, Crystal, Shelley, Edna, I see David on here, Aaron Smith. You guys were amazing. Susie Malloy, I think you probably have the record for a number of Zoom calls in a legislative session and in probably a single day between NHF's Washington days and our advocacy days. We started out looking at trying to have an advocacy day, and then we're like, well, it's going to have to be 2 days, and then it became a week, and then it eventually became just a month of trying to line up as many Zoom calls and conference calls as we could. But I think overall it was a success, and I think if you look at those numbers, I mean, those are comparable to in-person advocacy days. And again, thanks to all of you for being so flexible and trying your best to make it work. Trying to juggle jobs and personal lives and trying to get on these calls. People were getting on calls in our lunch breaks, and it was wild, but I think it was worth it. And the last thing I'll say about that is, and Nathan's made this point, and other people have made this point about other advocacy days and NHF's Washington days as well, that even though we persevered through this year, I think it was very much a learning experience, and there's no reason to think that we're not going to have an in-person advocacy days next year. But why not continue to do both? I think that people are legislators and everyone else, they're used to the technology. It's a great supplement to, if people can't, if our members can't make it to Columbia on advocacy days, why not have Zoom calls, and why not have them throughout the year? So I think it's something that is, in a way, has become an asset for us, and I hope that we can, I think we've learned a lot from it, and hopefully it can benefit us in the future. So the Phone to Action campaign, I think most of you are probably familiar with it, because I've been hounding you all year to sign up. It's a great tool that NHF has signed up for, allows chapters to participate in. I won't go into a lot of details because I think you're familiar with it, but it's just, even if you're not familiar with ours, it's a way to, you've probably done these before, where you log in. It's a campaign that you log in, and it generates, you put in your address, it generates who your legislator is. But the important thing is that it allows us, this is a little different than some campaigns I've seen. It allows you to send a personal email to your state legislator or members of Congress. We've only used it for state legislators at this point. But it was a vital tool working on our RDAC bill. We sent out at least 3 or 4, I think 4 communications. Again, these are personal emails. It's so much better than a legislator just getting another email from from staff at HSC. Personal email coming from a constituent. We did it, I think, for a subcommittee vote, committee vote. And it's so intuitive, and it's easy to set up, and it's easy for members to use. You just log in and send this email out, and it helped us really push hard. with this Rare Disease Advisory Council bill. And I'm not going to talk a lot about that because we have, as Sue said, we've got Anissa from the National Organization for Rare Diseases is going to talk about that in a minute. But just to give you a little bit of the timeline, so we did pass the bill out of the House. It was in April, which was after crossover day. That just basically means that the Senate can immediately take up the bill next session. It's already been assigned to the Medical Affairs Committee there in the Senate. But we got thanks to Representative Leon Howard, it was assigned to his committee, the M committee. We got it. I think Sue testified as part of the subcommittee hearing. I think it passed. I don't know if it was unanimously, but it passed out of there pretty easily. Got a committee vote in mid-April, and then it passed the House. I think the final vote was 63-45 out of the House. So if you're not familiar with it, it's a council that sets up. It comprises policy experts, medical experts, and then member advocates from a variety of rare diseases. We know hemophilia is rare, but there are some diseases that you're one of a handful in the state or even the country or the world. And the idea is just, power in numbers, trying to bring different groups together to inform policy that's made in the legislature and at the executive level in South Carolina. So we're excited to hear. I think there've been some changes, and Nisa's going to fill us in here in a few minutes. And the last thing is resolutions and proclamations. I think the final count, I think there are a few maybe still out there, but we've got at least 12 proclamations. The governor's proclamation included in that, recognizing March as Bleeding Disorder Awareness Month in South Carolina. And it's been a tough year. One of the motivating things is, because I can't remember how many we had, but I think we were number one in the country last year. But one of the motivating things is that you obviously haven't been able to have the in-person, photo ops with local officials and state officials. But thank you again for persevering through a tough year and getting, I think, is a very respectable number, 12 resolutions in different cities and counties and at the state level in South Carolina. So hats off to you, and thanks for sticking with us through a tough legislative session. No doubt next year, well, cross our fingers, next year will be a little smoother. So, and I think that's all I had. Did I miss anything, Sue?
No, that was wonderful, Jeremy. Beautiful wrap up. The only thing I would add to that is I want to say thank you to NHF for providing us the platform for the phone to action. It really was super. It's been great. So if you're not connected with that and you're on this phone, you're on the screen here, just let us know and we'll get you connected. You do need to be South Carolina because it's South Carolina driven for our own legislators. But I do want to give that shout out, and I'm sure Nathan could say something in regards to that, but it's been a great thing. And if we can get you connected and make it simple and easy, because we know everybody's time is valuable, but it does make a difference.
I can't think of another way you can get out, 20 individual emails to committee staff from constituents on the day of a vote. It's just a great tool.
I wanted to add to that too, Sue. Like just in my family, like I joined it or whatever, but I can forward it to all of my kids, my parents, whatever. And like you said, and just multiply. It's so easy, so simple, so quick to go from one voice to 15.
Absolutely. People did it in their work. And so we'll use that, as we go on, because the RDAC is one thing, but we have other things that are still concerning us in our state, and will always be. It seems like every time we take one step forward, somebody finds a way to deny us our access. And we're like, what is this now? So we do have some things that are of great concern that I am worried about coming down the pike. But today we've been discussing that a lot, but today we're just going to kind of wrap and stick on this and let you guys get on your day. This is really a celebration for all of you and your work. And I couldn't be more prouder for the work that we do on behalf of the chapter and all of you. So now we're going to go switch have a little fun. So Greg has put together a little video, and how this came, you're going to see, and he's going to narrate it very quickly. We were trying to make sure that we had plenty of time. We got 4 minutes before Nathan's going to be on, if we stay on schedule. But what this shows is we were very lucky. I know many of you, probably most of you, work, and you don't have that opportunity to go, oh my gosh, it's going through a vote, dial in and watch these things live. I have never learned more from watching these processes of how fast a bill is voted on and things that happen, and you're going, wait, what? You're kind of doing this kind of stuff. So I put together a little video here of some of the things as our RDAC moved through our state legislation, and kind of what we've learned and how hard it is to get a bill passed. The House was easy. The Senate would be much harder, is what we've been told many times by our own House representatives. So Greg, I'm going to turn this over to you. Hopefully it'll run.
Yeah, no. So we made a quick mega cut of the bill being introduced, the testifying before the committee, it going to the full committee, and then going to the full House. And we've gotten this thing down to like 3 minutes. So this is basically the entire life of our RDAC bill up to this point. So first, it's going to be introduced.
Mr. Howard, South Carolina Rare Disease Advisory Council.
For the House 3M committee.
That was it. That's all it took for it to be introduced. 5 seconds.
To establish the South Carolina Rare Disease Advisory.
So we're now in the subcommittee, and they're going to read the bill and then discuss it and then take testimony from Sue.
Advisory Council within the Department of Health and Environmental Control. Before we acknowledge any of our speakers, any members of the subcommittee, I know you've had a chance to review the materials. Do you have any discussion before we go to any of the speakers?
Thank you, Mr. Chairman. I just want to say that this is something that you would have thought we already had in South Carolina. And given the number of just the agencies that have an interest in this and making certain that these rare diseases.
Folks on.
So this representative, she already knew all about the bill because she actually read the packet we sent her. So she knew. She goes into talks about how she doesn't know anyone with hemophilia, but she thinks it's important. And so our pregame of putting out the packets really benefited because we already had one representative who was in favor of it. Now we're going to listen to Sue testify.
Teams, are they ready? They're ready? Okay, great. Ms. Martin, are you there? You ready?
I'm here. Can you hear me?
Yes, we can hear you now. Thank you.
Thank you. Thank you for the opportunity to provide oral testimony to the Health and Environmental Affairs Subcommittee today. My name is Suzanne Martin. I live in Greenville County, and I'm the Executive Director of
So we're still in the heart of COVID. So we're doing a virtual. Now, usually we go to in person, but even doing this virtually, you can see Sue is ready to testify. Her hair looks good. She's well dressed. Her background looks amazing. She has written out her testimony beforehand. She's not just going to wing it and hope for the best. And she's going to do what we do best, which is she's going to tell our story. She's going to tell her story of what it is to be somebody raising children with a rare disease and having a family with a rare disease.
Hemophilia South Carolina, the state's only nonprofit advocacy organization that represents. And I respectfully ask the committee to please send H 3956 to the full committee with your support. I believe that South Carolina has a great opportunity to support the rare disease community, and I thank you so very much.
So we're going to follow this up. There's going to be a quick Q&A.
Representative Bustos.
Yeah, thank you, Mr. Chairman. My only question is, does the medical community have anything like this?
So Bustos, simple question. Just want to know, we follow up that no, there isn't anything currently in South Carolina, and we really think having an RDAC is important because it will be good for South Carolina.
Chairman, if you're ready to accept motions, I'd make a motion that we recommend to the full committee approval of this.
And there was a motion by Representative Bustos. Did I hear a second? Moved and properly second that we approve H 3956 to the full committee. Madam Clerk, if you will call the roll.
So this whole subcommittee, if we went through this whole thing and we sped everybody up talking, it is really only 20 minutes. It takes 20 minutes for our bill to, go through the furnace of a subcommittee, and it'll pass out and go
Ms.
to the whole
Brawley?
committee.
Mr. Bustos?
Aye.
Thank you, Mr. Chair. 3956 is a bill by.
So now we're in the full 3M committee and they are going to reread it again and discuss. There will be no testimony and we don't get to answer. They only have the information we gave them.
Our chairman, Representative Howard, this bill establishes the South Carolina Rare Disease Advisory Council within DHEC. The purpose of.
Thank you. Is there a federal agency that studies and adopts policies related to rare diseases?
I would be willing to go and say yes. The Center for.
Mr. Howard.
That's the downside with this is it jumps around a lot. We did not actually do a good job at saying that there wasn't a federal organization that would handle this. Representative Hart covers it, but we have to think of all the things that we can think of to inform the reps and soon to be senators so that if there is a question, we'll be able to answer it properly and that when they discuss it amongst themselves, they'll have the correct information.
I know for South Carolina in specific, this is an issue that we want to take up to make sure that our citizens were taken care of, especially some of the rural populations and low income who don't have the readily and immediate access to.
But Rep. Hart does give a nice, solid, clear reason why, even though we do have, even if the national organizations are doing it, we still need to have a local one to think about our own citizenry in here, South Carolina. Next, we're going to go through a very speedy version of the vote.
Call the roll.
Ms. Brawley. Aye. Mr. Bustos.
Aye.
Mr. Carter.
Aye. And then finally, this is the full House vote. And if you'll notice, some people will vote for it, then look at the board, vote against it. This is actually 5 minutes long, so we triple speeded it up.
I want you guys to look at Crawford. The second column is green right there. So watch what happens after a little while. It was green and now it's red, a no vote. So what we found watching this was sometimes, and this is going to be a great lead into Jeremy to finish up this conversation of what do you do when all of a sudden, you think that you're whoever you had spoken to, or we thought we had good relationships. Something happens when the full vote goes and they vote no. So Jeremy took it upon himself to ask his representative that, why did you vote no, on this bill? Just curious to see what would happen. And we discovered something that we've now said, we have to think about, didn't even think about that. So Jeremy, would you like to share that really quick?
Oh, sure. Yeah. So after the second, the roll call vote, I had spoken to my representative on the phone just a couple of weeks before about the bill, and he seemed supportive. He didn't voice definitive support of the bill, but was sounded receptive to it. And he gave me his cell phone. He's a very nice guy. He's pretty new. So I just, like Sue said, I just called him up and I was curious to know why he voted against it. And very nicely, if this is, I want to take this opportunity since this is a training that, I just I didn't want to be accusatory. I just said, Representative, I know we had talked about this and I was curious to know if I could address any of your concerns about the bill. Very simple, just kind of put the ball in his court. And he said that, so I'm not even entirely sure if he knew that it was actually our, it's not to defend anything, but they have a lot of things they're juggling. And so, but his reasoning was that he wasn't in support of it being housed at DHEC. And he had some good reasons for just in general reasons about in the middle of COVID, the DHEC is overwhelmed with COVID response and that kind of thing. But anyway, it was the point is that it was a great opportunity to have a conversation. So two things. It illustrates Greg's point about how tough it is to just stay on top of these things, and also to Sue's point about how we need all of you to contact as many of these people as we can to make sure that they know that this is, if Hemophilia South Carolina has a bill that, this is who it impacts. It impacts my constituents. And if I don't support it, I'm going to be getting a call from those guys. But the other part is that it was a learning experience. We learned, and this is hopefully information that we can use going into the Senate, that there are some reservations about this specific aspect about where the bill is going to be, where the council would be held, housed. It was a learning experience, and that was ultimately I think there was some benefit in that. So.
Thank you, Jeremy. And that's exactly what I wanted to share with them. We learned a lot. Sometimes a no vote lets you understand what's going on in other people. We didn't do enough work, or we need to explain more, or whatever, and they have the right to say no. But it was just a fascinating way to find out some more information. I appreciated, Jeremy, the way you shared that. You didn't say, hey, how come you voted no? You said, hey, I want to know if you have some concerns, and that brought up again, another learning lesson. That's a beautiful way to put that. I probably would have said, hey, I thought we talked, so.
That was my motivation. It was already after the vote. So that was my motivation for calling him, that I was a little annoyed that he didn't vote for it. But you don't want to burn bridges, right? I mean, he's been very receptive to us, and he's been voice support for our, and so we want to continue that relationship and go to him next year, but keep pressing, go to him next year and say, hey, this is important. We're working on this year, and we really want your support on it.
Perfect. So now we're going to go into our national policy, but as we kind of wrap up this, I do want to also share some words that Representative Adam Morgan said on our video. We have that if you haven't watched our opening statements of our opening ceremonies. But he did say, your group is so well organized, such great advocates. Everything about the group and what we do down at the State House, he was just elated with, and thought that we were great and continue to do that work. So again, kudos to all of us for getting our training, all of our national folks that, it comes from the top down. We don't know what we're doing, because we don't know what we're doing, and they train us, and we all work together collectively. So I'm very proud of South Carolina, and we definitely have a voice in the legislation. They know who we are, and they know that we respect them as well, that, they have big decisions to make. So going on with all of that, I'm going to turn it over to Nathan. He is going to pull up his slides. Awesome. And Nathan I'll let Nathan introduce himself, but most of you all know him, but we are very well connected with NHF and with Nathan. And I'm just going to turn it over to you, Nathan. Again, thank you so much for being here. So appreciate you always.
You bet. You bet. So hi, everybody. Good morning. I'm Nathan Schaefer. I'm the Vice President of Public Policy for the National Hemophilia Foundation. And I just have to say, I'm so proud of y'all. You guys are the Rare Disease Council in and of itself is just a case illustration of how connected you are, how great you are with making connections, maintaining connections with your elected officials. You're just kicking butt in South Carolina, and I'm so proud of the way that you've been able to structure and maintain your advocacy programming. Y'all are doing great work. So it is a pleasure for me to be able to be with you all this morning. I'm just going to go through a few things here to give you all a update of what's going on at the national federal level as it pertains to bleeding disorder programs. I'm going to talk a bit about what's going on in Congress, what's going on for NHF at our federal policy and advocacy agenda, a little bit about Washington days, and I'll be happy to take any questions when we come to the end of this. So in terms of Congress, there's a very close margin of who's in charge. Who's got the majority in both of the chambers. It's very, very close. In the Senate, as you all probably know, it's 50-50 right now. So there is a desire and a motivation for legislators to actually work across the aisle. They have to work in a bipartisan fashion to actually get things done in the current climate in Congress. There's not a huge super majority in either chamber, so both of them have to work very closely with one another. I will say there is a ongoing, lingering impact of the events that went down on January 6th, where there were a lot of protesting, a lot of violence that transpired early in January, there was a desire for both of us to actually have authorization for a congressional investigation into the events that transpired on January 6th. Ultimately, that did not pass. So there was not an official commission that was authorized earlier this year. But there's definitely a lot of impact that still lingers from the events of January 6th. This is a general overview of our federal policy agenda in terms of the things that we continue to monitor and try and pay very close attention to, which I'll talk more about in terms of appropriation in a couple of slides. I have to acknowledge the Hemophilia SNF Access Act. SNF stands for Skilled Nursing Facilities. This has been a long-standing problem for the bleeding disorders community. Skilled nursing facilities aren't nursing homes, but I'd call them sort of nursing home light. These are facilities where patients with bleeding disorders have been referred either after a surgery or a challenging bleeding episode. SNFs, skilled nursing facilities, before this bill has been enacted, were not able to bill for the cost of clotting factor on top of the cost of a per diem daily rate of what it costs to be in a skilled nursing facility. So what this meant for bleeding disorder patients was basically a revolving door. People got referred to a skilled nursing facility. The facility realized they weren't able to bill for the cost of clotting factor, and so patients were sent right back to the hospital or sent home, which is really problematic for many, many reasons. Long story short, this bill got incorporated into legislation that actually passed last December. And going forward, effective October 1st, which is when the new federal fiscal year begins, skilled nursing facilities will be able to accept patients, bleeding disorder patients, and be able to bill for the cost of clotting factor, which is a huge victory, not for the largest number of patients, but for many, many who rely upon this kind of consolidated, coordinated care at an intense facility like a skilled nursing facility. So it is a huge win for our community, and I just want to say thank you to everybody who advocated on behalf of the importance of access to skilled nursing facilities for bleeding disorder patients.
And can I just interrupt that we did have for several years, South Carolina has been down there advocating for NHF for this. So all of you that have been with us to Washington, and for everyone, this is huge that we were able to do this, and this helps David and a lot of other people. So just so kudos to NHF for help us all get to this point. It's huge, really exciting.
It is, and I have to say, from an advocate's perspective, it's rare that you actually see bills become law. The reality is that 5% of bills that are introduced in Washington, D.C. actually become law. And for many of those bills, that is intentional. A lot of times bills are introduced not with the actual intent of becoming law, but rather for the intent of raising awareness and educating policymakers about the importance of whatever issue, population, what have you. But to be able to see a piece of legislation that has significant merit become law was very rewarding from an advocate's perspective. But to Sue's point, thank you to everybody who helped make this a reality. It is a huge victory for our community. So if you haven't been to Washington Days, I'm going to personally invite you all right now. Washington Days usually takes place in late February or early March. This past year, we had almost 400 community members from 47 states represented this year. We did virtual meetings. We got on Zoom just like this and met with members of Congress and their staff about issues that are of great import to the bleeding disorders community. Hopefully, we'll be able to convene in person in 2022, but I don't know with certainty yet whether or not we'll actually be able to do that. We might have to do virtual again. Personally, I hope not, because I really want to be together with all of you and other advocates from all across the country. But Washington Days is sort of the pinnacle of our advocacy efforts on an annual basis. And I hope that you're able to join us either in person or virtually to educate members of Congress about issues that are of importance to the bleeding disorders community and about federal appropriations for bleeding disorder programs, which I'll talk briefly about. Every year, we are advocating for federal dollars that support bleeding disorder programs. That includes research, surveillance, and support of the Hemophilia Treatment Center network. There are 104 hemophilia treatment centers, HTCs, across the country. Every year, they require support from the federal government to be able to maintain their operations and support the bleeding disorders community. And every year we're fighting for every single dollar that can support all of their vital programming. I am happy to say that this year we anticipate all of those programs at the federal level will receive the same funding that they have received in recent years. We don't expect that there will be a significant increase nor a decrease in support of federal funding for bleeding disorder programs, which in the current environment in Washington is a huge win if you're able to experience what we call flat funding, which just means the same amount, which, like I mentioned, is a huge victory in the current climate. Just want to talk briefly about accumulator adjusters, which is a very complicated insurance conundrum whereby patients are experiencing situations where their copay assistance, coming often from their manufacturers, don't count towards a patient's out-of-pocket deductible. What this has meant for a lot of patients with bleeding disorders is they will get a bill from their insurance company, often in the first quarter of the year, that can be upwards of thousands of dollars that they didn't experience in years past because their copay accumulator counted differently than the way the insurance companies are currently interpreting it. There is a desire among advocates and many folks on the Hill to actually introduce legislation that would address accumulator adjusters at a federal level. We didn't have a bill that would address the issue when we convened in Washington earlier this year, virtually. So instead, we circulated a letter. It's called a Dear Colleague letter. This is a common tactic where you don't actually have legislation yet, but you're trying to generate as much interest and support as possible. So we sent a letter to President Biden, and it was signed by 58 members of Congress saying, this issue is important to us. We would like to see legislation introduced to address the issue. Please, please, please make this a priority. So we sent that in March, and there were 58 members of Congress that endorsed the letter, which is not the smallest of numbers when you're thinking about members of Congress who can endorse any kind of call to action. We don't have legislation yet, but we do anticipate that we will, probably in the next couple of months. Finally, I just wanted to talk briefly about the Affordable Care Act and the lawsuits that have been introduced to challenge it. This is just a brief sort of synopsis of all of the legislation that has been introduced challenging the ACA. The one I will draw your attention to is the final two, and that pertains to the individual mandate. That is the provision of the ACA that requires folks to actually have health insurance in place for all of their employees. That was challenged by a court in Texas, and it actually challenged the entirety of the ACA by saying the individual mandate was struck down as unconstitutional. It brought into question the entirety of the ACA, and that elevated the uncertainty of the ACA all the way to the Supreme Court. And we have been waiting with bated breath to see what the Supreme Court would ultimately do. And they just made a ruling 2 days ago that they have upheld the ACA despite the challenges relating to the individual mandate. The ACA had not been struck down. So the patient protections that are included in the Affordable Care Act, notably for our community, protections for people with pre-existing conditions and annual and lifetime caps are no longer uncertain whether or not they would be protected. The ACA in its entirety has been upheld by the Supreme Court. So without getting political, ultimately, at the end of the day, in terms of the patient protections that are so important to our community, those have been upheld. And I think it has been very, very good news for those with rare disorders, including bleeding disorders. So I'm going to stop sharing my screen. Happy to take any questions. But like I said, I'm just proud of y'all. You're doing great, great work from an advocacy perspective, and I'm really proud to be part of it. So thank you so much.
Anybody have questions for Nathan? Okay, if not, then I am sharing, let's see, does this go all the way? There we go. I'm going to share Anicia's slides. And since I can't see anything, Anicia, I'm going to let you go ahead and introduce yourself. And thanks so much for being here with us. And just tell me when you need me to advance.
Perfect. Thank you so much. Thank you for having me. So I am Anicia Reed, and I'm the State Policy Manager for the Eastern Region at the National Organization for Rare Disorders. Next slide, please. Thank you so much. So before we jump into what a Rare Disease Advisory Council is, I'd love to share a little bit of an overview of NORD. So NORD was established in 1983 and was instrumental in the Orphan Drug Act, which created financial incentives for the development of treatments for rare diseases. So for more than 30 years, NORD, along with our 300 plus patient organization members, have led the way in voicing the needs of the rare disease community, driving supportive policies, advancing medical research, and providing patient and family services for those who need it the most. Next slide, please. Perfect, thank you. So let's start with the problem. So more than 25 million Americans are living with one of the more than 7,000 unique rare diseases. So that breaks down to about 1 in 10 Americans. So even though that might seem like a lot, there's several decision makers that still have limited awareness of the issues and impact that rare diseases have on patients, their caregivers, and the overall healthcare system. Perfect. Next slide, please. Thank you. So what's the solution? So we believe it is to form rare disease advisory councils, or RDACs, where a diverse group of those in the rare disease community come together to advise state governments about the unique challenges that the community faces. So this is especially important as many healthcare decisions are made at the state level. So we also see this as an enormous opportunity for the community and legislators to come together to partner in a more strategic way to address issues on a regular basis. So you might also be wondering what exactly an RDAC does if you're not familiar with them. So it is an, again, opportunity for a diverse group of people within the rare disease community to partner and voice their thoughts within the rare community. So this legislation is introduced. It has a duty section, and that lists what each state RDAC will be working on. So RDACs typically seek public input to hear directly from the community about what needs to be addressed in the state. And a question that we often get is, hey, how can one council address 7,000 diseases? How do you pick and choose what to focus on? And so the truth of the matter is that people in the rare disease community, they all often face similar issues, no matter how different their rare disease is. So access to specialists, different ways to access specific care. So that's what's unique, is bringing together, all these folks with all these different connections, and also having a community that, understands similar barriers and how they can work together to overcome it. So great, next slide, please. Perfect, thank you. So I want to do just a quick overview of some of the work that has been done to support state RDAC efforts. So we really want to continue increasing the number of RDACs throughout the country and to continue to work to strengthen the existing RDACs, to give as many rare disease advocates a voice in state government as possible. To date, we have 18 states that have signed RDAC legislation into law. So Louisiana's was actually signed this past Thursday, and New Jersey and Florida's RDAC bills have passed through their state legislatures and are both awaiting the governor's signatures. So we've really worked to develop some state-based coalitions to support and provide opportunities that encourage RDAC collaboration. So we really encourage that different state RDACs collaborate with one another to share ideas and best practices. And we plan to continue to develop and release different toolkits, one-pagers, host webinars, and convene additional meetings to really support this ongoing RDAC work. Perfect. Next slide, please. Thank you. So let's dive a little bit more into what RDACs do. So of course, my dog starts barking right now. So the legislation that is introduced has a duty section. So this lists what each RDAC is going to be working on. So this slide shows examples of some duties, but again, every state can look a little bit different. And RDACs have typically convened the public to hear directly from them about what needs to be addressed within their state. They've also worked to consult with rare disease experts to improve access to quality issues related to health insurance, education, and treatment. They work to make recommendations to the legislature and other state agencies that work with the rare disease communities. Some of them have listed a publicly available resource list on their state website. And finally, some states have worked with some specific programs that affect their community and to strengthen that. So this is just a quick look about what we've seen some RDACs really focus on. But again, and we do want every state to look different because every state has different needs within their rare disease community. But we are excited that South Carolina's bill has included a lot of this model language, which is really exciting and something that we've all worked together to see. Perfect. Next slide, please. Great, thank you. So as mentioned, to date, 18 states have signed RDAC legislation into law, and several others, including South Carolina, which we're very excited about, has pending RDAC legislation. So I wanted to quickly share just a few things that some other states have done as well. So for instance, New Hampshire, Pennsylvania, and Minnesota have worked on patient surveys. So after their RDAC passed, they worked to get surveys out to their communities to assess their needs, what's impacting them, and what they would like to see the RDAC work on. North Carolina has worked to improve their state's newborn screening program, and they've put out a white paper that gave guidance to the state's legislature on how they can fix their state's newborn screening program. So those are just a few other specific things that we've seen some states focus on. Okay, next slide, please. Great, thank you. So as mentioned, we're really excited that South Carolina's RDAC bill, House Bill 3956, was introduced by Rep. Howard in the 2021 session. So really excited to share that the bill, again, mirrors a lot of the model language and a few strong duties that this South Carolina bill, where the RDAC would be tasked with, is researching and identifying best practices to reduce health disparities and achieve health equity in research. So prior to this bill being introduced, we came together as a community, and a lot of you were present and sharing that health equity issues are really important within your state. So we're really excited that that's included in the duty section. Also to research, diagnosis, and treatment of rare diseases, distribute educational resources for healthcare providers to foster recognition and optimize treatment of rare diseases, publish a list of existing publicly accessible resources on research, diagnosis, treatment, and education relating to the rare diseases in South Carolina on the council's webpage. Perfect. Next slide, please. Thank you. So we're really happy to say that we have a strong coalition made up of South Carolina rare disease advocates that have been coming together to discuss state needs that they'd like the RDAC to address and to brainstorm next steps that need to be taken to get this legislation across the finish line. So to get involved in more of our RDAC efforts, please feel free to send Sue and I an email, and our emails are listed on this slide. As mentioned, House Bill 3956 passed through the full House during this past session, and it was assigned to a subcommittee in the Senate where it will be heard in January. So we've also been exploring the option of trying to include the RDAC legislation in the South Carolina budget. So if successful, which we are very optimistic about, the RDAC would be housed at the Medical University of South Carolina. So the latest update is the proviso was recently adopted by a conference committee. So the next steps is it will go back to the House and the Senate. And once it hopefully is voted out, it'll be signed by the governor. So we don't foresee too many barriers. We think this is a great option to make it very stable. And, we have support from the university to move forward with it, which is really exciting. So what can you do to help make an RDAC a reality in South Carolina? So reaching out to your senator, asking them to look into sponsoring this legislation. In January, we're going to need a really strong group of senators and several co-sponsors to help champion this important bill. Also, please consider participating in the South Carolina RDAC Coalition meetings. This will give you an opportunity to use your voice to share what is important to you and what you'd like the RDAC to address. And it will also help you stay up to date on next steps to get it across the finish line. And lastly, to become more involved in our efforts, please visit our Project RDAC website that's listed on this slide and send our team an email at rdac@rarediseases.org. And then also becoming a Rare Action Network member is free. And I will drop this link in the chat here. Perfect. And so what the Rare Action Network consists of is a broad spectrum of stakeholders. And if you're or whatever state you reside in, you'll receive some state-specific updates, including when the coalition meetings are. And then while working predominantly at the state level, the network also filters information from our national federal policy team to help address issues of national concern. And with that, I just want to say how much we appreciate Hemophilia for all the amazing work that they've done to get this legislation where it is and their partnership with NORD. And I really appreciate the opportunity to share a little bit more about RDAC work. And with that, I'm happy to answer any questions that anyone might have.
If you have questions, go ahead and just unmute yourself, guys, unless you put it in the chat.
And I'll also drop my email address in here in case you think of any later.
Okay, thank you. That was wonderful, Anicia. You really wrapped that up, why we need that RDAC very well. So I really appreciate that. So before we close, I want to keep everybody, on schedule here. But before we close, we also have up in the beginning of the chat, we have a survey for our annual meeting. I'll also be sending that out to you all later. Everybody that has attended, we really like it. It's 5 questions. You can take that survey. It's just a little survey monkey letting us know how we did and how important the annual meeting was and your satisfaction. It really helped us out. I don't like surveys, so it's very quick and easy. So just a couple of clicks and it gives us a brief idea of what you thought. So wrapping up today, again, I just want to thank all of our sponsors and I want to thank Anicia and Nathan and Jeremy and Greg and Crystal and each and every one of you for all that you do for us and everything that we collectively do for South Carolinians living with bleeding disorders. It takes a village of a lot of people and being a partnership with the rare disease as well. We will get this over to the governor's desk and I'm assuming we'll all let everybody know so that we can hopefully take a picture or whatever we do to see that that was done. But also I want to just recognize today that we are meeting on Juneteenth. This is now a national holiday. It's very important to all of us that we recognize the importance of Juneteenth. And so I have a little video because just in case somebody's not quite aware, I wanted to share this really quickly and then we'll close with any conversations that anybody would like to share of the importance of this. So let me get this going good. And here is Juneteenth and a little bit of the meaning about why this is so important to our African American community and to all of us.
a U.S. history book, and chances are its author will quickly point out January 1st, 1863, the date President Abraham Lincoln, with one proclamation, orders and declares that all persons held as slaves shall be free. What that same history book might fail to mention is what happened to these words once they arrived on the shores of Galveston, Texas, more than 2 years after Lincoln wrote them. In the 1860s, word didn't travel like it did now, and in 1865, months after General Robert E. Lee's surrender, word of the end of the Civil War had yet to hit the southern state and its 250,000 slaves. And then came General Gordon Granger's arrival in Galveston, June 19, 1865, and General Order Number 3, all slaves are free. Juneteenth was born. While Juneteenth celebrations continued to varying degrees in the U.S. for decades, it would take until 1980 for Texas to become the first state to today 47 states recognize it and the District of Columbia. A chapter of our history for far too long left out of the books designed to document it, but no longer.
Whereas
the National Museum of African American History and Culture now calls it our country's second independence.
Oops, hang on. Oops. Let me stop. Sorry about that. So I just wanted to close on this important day and open up. Does anybody have anything they'd like to share on the importance of today, or just what you've learned, if maybe you didn't know what Juneteenth was, before we close out for the day?
We should note quickly that it became a national holiday this week, right?
Yes, yesterday, or I think yesterday.
Absolutely. Yes, it did. And Sue, I just want to thank you for recognizing and being able to, give a little history with Juneteenth. I think it's important that we all just know a little bit of history about that. So I thank you and the bleeding disorder community to presenting that.
Absolutely. Absolutely. Anybody else? All right. Well, I can see we're 8 minutes over. Our teens, I've got to get myself a second cup of coffee so we can hang out with our teens. If you all have teens, please have them come on at 10:30. We've got some good advocacy for them. Nathan, I'm so proud of you. You're going to lead the way with the ones that are on here now. So I just want to close with that.